So I'm Lacy Dicharry. I am a person in long-term recovery from mental health and substance use. And I was a person who experienced the mental health system, the foster care system, aged out at 21, and did a lot of work around incorporating lived experience, particularly the youth voice, into systems change work for almost 20 years. So yes, I'm like 39 now, and I'm trying to get my head wrapped around that. So I do have that lens and that positionality for this research of having been a young person and really one of the first youth leaders and experts in the child welfare side, bringing that lived experience at a national level, and then in a more formalized consultant role. And then realized through my own unmet mental health needs, there's this whole youth move happening on the mental health side. And then, that led to getting involved with SAMHSA and a lot of national initiatives, working in a lot of communities across the United States. But then after, about 15 years of that, I realized we put so much work into these systems and trying to change these systems, and it was just to get just a tiny little bit of change. And so I really value the impact that youth peer support and really peer support has, period, because I know it's made a huge difference in my life. But also noting that the places that had a lot of the places that had more long-term sustainability, that had higher outcomes, that had better collaboration, really were the ones that invested in leadership development, right? So that is how I got involved, and I'm getting my PhD in leadership and human resource development at LSU. So I'm excited to be here with y'all. So a little bit, and if you all want to turn your videos on, or if you want to just chat along the way, or if you want to jump in and ask questions, feel free. I really prefer to have like an interactive workshop, but I'm happy to present the research and what I'm working on as well directly. So I like the human side, human piece. So yay, I see faces. Okay, great. Hello. So that's what I've been, so in my PhD program, I've been really focusing a lot of my term papers and projects on this lived experience workforce, because I know the impact, both having been a person receiving support from the lived experience field, as well as giving support, and then doing this high-level systems work across the US. I was the executive director of Youth Move National when we transitioned to an independent organization. And so I was highly involved with SAMHSA and like the national standards and, developing, kind of setting that precedent for youth peer support specifically. So I'm really excited about this work and being able to take it to that next level and apply human resource development and leadership development principles into our lived experience space. So I'll go over a little bit of the intro and the background. I'm not going to spend as much time on these because I think y'all know what lived experience is and, how it shows up in work. But individuals who are directly impacted by a social issue or a combination of issues, and then using that experience to inform systems and services, right? So those are sort of the definitions that emerged from another research piece that we did with ASPE, where we looked at, how are different federal agencies utilizing lived experience across their systems, and what are the, and that was really driven heavily in partnership with people with lived experience across different systems. Now, the important thing I think to note for any practitioners is it's really important to talk about what is the context of lived experience and defining what that lived experience is for a particular project, role, position, because everybody has some form of lived experience, but really the important thing is, do you have it in the system that you're working with and involved with, and how are you applying that, right? So when you get into that professional application of lived experience, that's what we call lived expertise. So I'm not going to go over all of this, but just to say that the evolution of the workforce has shifted over time, right? So the adult peer movement was really a huge part of pioneering what consumer and lived experience could look like in a more formalized setting. Of course, we had 12-step recovery and that sort of thing before, but that was more of an informal setting. And so that was pioneered. And then we had the family support movement on the mental health side coming in a few decades after that and kind of developed that. And then from the family movement emerged the youth peer support. And so, it started out as youth, just advocating for services on boards and internships, then creating advisory boards, then working alongside of the professionals in that partnership, that co-led partnership. And then SAMHSA eventually, once they started the system of care, they actually required a full-time FTE of a lived experience person. But the challenge was people didn't really know how to define it. They didn't know what to do with it. They didn't know how to put it on job descriptions. How do you navigate asking and requiring lived experience in mental health, but yet that's a protected class? And how do we ask about that in an interview? What does that look like? So that was some of the challenges that kind of emerged through that workforce evolution. And then youth peer support, being able to be funded by Medicaid, that formalized it even more, requiring certifications and trainings. And so the application of human resource development really took hold here, not only in systems change, but organizational context and culture. How are we educating non-peers about the peer workforce or the lived experience workforce, how to work together in a really good way? What are the training mechanisms that are actually supportive of learning transfer for lived experience? How do we apply lived expertise? How do we teach that? How do we define it? How do we build competencies around it? So that's really kind of where my work comes in bridging all the lived experience stuff, but the human resource development and leadership stuff, right? So we've had this huge evolution of like, okay, lived experience, workers are sharing their stories and then moving into direct service. Maybe they're running programs, but we hadn't really defined and developed what capacity or competencies are needed to utilize lived experience, right? So for example, strategic sharing, that's a huge piece of it, but we hadn't really named that and built in the specific competencies or the behaviors, actions, characteristics, that we needed for those specific roles and functions. So that's kind of what I have been working on for the last 5 years. In specifically in my PhD program. I've done some work on it before then, but so I'll talk a little bit about career pathways, and I'd love to hear y'all's responses to this too as we go through. If you're seeing like, does this resonate? Is this kind of what you've seen? Does it feel different in your area that you are focused on? I'd love to hear feedback from that in the chat as we go, if you're up for that. So the career pathways, right? So I've had, just through my experience over the last 20 years, I had a lot of young people saying, I want to do what you do. How do I do that? And first I was like, what is it that I do? I'm not even like, what am I doing? What is it? I didn't have names for any of that stuff, right? I didn't know that I was doing consulting and organizational development and change management and training and facilitation and, board development and governance. I didn't have words for that whenever I first started. And so as things evolved over the years, we kind of looked at, career development is one of the 3 tenets of human resource development, right? And so I'm really looking at what are the career pathways, what are the opportunities for people with lived experience to really do whatever it was that I was doing, right? And so this came out of I literally woke up at 2:30 in the morning with this as a dream and coming out of my head. And so I kind of developed this and then, had it validated, ran it through and got feedback from other advocates who had been in the field for a long time and really looking at what does that evolution look like. So when we get involved with a system, or we find support and something that helps, or maybe something that isn't as helpful as we wanted it to be, but we can go and provide that feedback and support, then we want to get involved. We want to make it better, right? And so what I was noticing across systems is that, some young people will go into the general workforce, but really if they want to use that lived experience implicitly, right, to where it's not a primary focus, then they tend to get involved in human service professions. So they might go into social work or counseling, or they might work at a nonprofit that serves young people, but they're not necessarily utilizing that lived experience in a very specific, intentional way, although it still informs the work that they do. And then as you move up into the advocacy programs, this is where people will get involved in specific causes using specific lived experience. And there's a specific skill set that needs to go with that, right? So it's more than just being able to show up and share your story. Like at this point, you start needing to be able to understand, how does my lived expertise apply to this particular function or role or goal that I'm doing? And how can I help to educate other people, as particularly stakeholders, partners, non-peers, about what it is that I'm trying to achieve with lived experience, so that they can also partner and support that. And then as you move up into direct service, right, this is where you use your lived expertise more specifically and intentionally. This is where you see it showing up as a requirement in job descriptions. You may or may not see trainings on how to do it, right? So strategic sharing is one that comes up that has been fairly developed. Like, when do I share what aspect of my lived experience in a way that is useful for whoever I'm working with? But there has been very little development around other skill sets that are required, right? Like program design, how to, outreach, communication, boundaries is a huge issue that came up in the youth peer support world, because they are the same age. They're wanting to, and social connections are so important at that age, but really blurring the boundaries. And so trying to figure it out as we go, right? And then you, at the sort of the pinnacle, is where you get into this, like, consumer-driven organizations, nonprofits. This is where you see that social entrepreneurship show up, where really people are building whole careers or whole organizations solely on lived experience. And so as you move up the pyramid, you see that more intentional and concentrated use of lived experience in the professional skill set. So we, as you can see the increase of lived experience as you move up the pathway pyramid. So the challenges of the Lex workforce, right? So we did this research in 2018. It was a qualitative research study on what are the existing challenges. And we talked to multiple youth workers, lived experience workers. And then we also had interviews with their supervisors, their direct supervisors. And so what we found, these are the primary themes that came out of that research, was really, really, really high turnover and very low retention of lived experience young professionals and organizations. There were a lot of reasons that led to this, but some places had 100% turnover within 3 months, over and over again, like every 3 months. And so it was a real challenge to hire and then support, because the job descriptions and the support wasn't clear up front. And supervisors were really struggling with, how do we support this lived experience workforce? Burnout is a huge challenge. Young people are still trying to figure out their own support, right? And I know across the lived experience workforce, we all still have to tend to our mental health. Like, we get into this role because of that, or because of our lived experience. And so we have to still tend to the lived experience while supporting other people in that process. And so the burnout, if we're not really intentional and careful about keeping boundaries and attending to our wellness first, burnout is happening at a really high rate. Lack of effective support and understanding the role of the lived experience workforce. So that's something that is really I think continuing to be developed depending on what system you're looking at. Like I said, mental health is a much higher developed because the adult consumer workforce has been around for so long. But like, for example, in child welfare, there's a lot less understanding about how to really support and understand what roles the lived experience workforce can take. Oh, this is great. I love these chats coming in. Cultural misalignment. Yeah. So I'm seeing that here, preparing the organizational culture. Yes, 100%. So our findings supported that as well. Like there was just a huge cultural misalignment, not only for the lived experience into the organization, but for young people, young professionals into the organization. And so that was, not understanding youth culture, youth language, young professionals who are fresh off of probably working at fast food or retail. Were the primary jobs that they've had. And so then coming into an office environment where you have to think strategically and plan and manage time is a very, very different approach. And so people or organizations who understood that were better able to support young professionals and lived experience workers in transitioning into that setting. And then limited professional development opportunities for lived experience workforce and for supervisors. So this was a huge piece. And again, this was a few years ago, and we primarily focused on the mental health aspect, the mental health system here in this research, but there just aren't a lot of professional development opportunities for young professionals. And then there was even less training for how to supervise this workforce. And I think there were other trainings for like the peer support workforce as adults, but there is a unique need and a unique support system that needs to be in place for the young professional workforce. So I'm going to just quickly go over this, and then I want to pause and kind of check in on the chat. So as we did this work in identifying what is the developmental stage of young professionals transitioning into lived experience workforces. And so the knowing, owning, sharing my story, this is when we're still earning our story. This is when we're still involved in systems, involved in services, still, in foster care, in juvenile justice, in the mental health system, really like in it, really earning that lived experience. And so, here we might start sharing our story as like an antidote or at a conference or just as a one-off as a co-trainer, but really just infusing that storytelling skill set to fulfill that lived experience partnership piece. But that's just the beginning, right? So once you kind of decide, all right, I want to do a little bit more of this, then getting into advocacy and moving beyond and understanding that my story is more than just me. Like there's a lot of other people that I'm representing in this work and in this field. And so understanding how to do that, how to mine data, how to present, how to field questions and answers in a way that is, more representative of the whole population rather than just your personal story. And then at some point, this is what we found is that there's a turning point, particularly for young professionals, where they decide they're either going to stay on this path, continue advocacy work and continue staying in this field, or they're going to go off and do something else, right? So there's a sort of a natural break because a lot of youth boards or youth services will cut you off at the age of 25 or 29. And so there's sort of a natural tendency to decide at that point, do I want to keep doing this or do I want to move on and go do something else? And so at that point, people really kind of make that decision. And they may still use their lived experience in other ways. They might come back and mentor, even though they're going to be a car mechanic or a dental assistant or going to medical school or whatever. And so then the the validation piece, I think, that really showed up in this workforce was that people needed to understand that their experience never goes away, right? Their lived experience is always valid, even though they may be aging out, quote, of a system or of a particular role, that their experience is still valid. And so that was one of the challenges that partners, well-intentioned partners, were telling, this lived experience workforce that, you're too old now, you're past the age of 25, therefore you're old, and therefore you're not really relevant anymore. And so that was a really, that was causing a lot of mental health distress for a lot of the advocates. Like, what do you mean? I've given my whole career to this role, and now you're saying I'm not relevant anymore. What do I do with that? And so that was really a major contextual piece to help support that workforce, but also the people who were working with that workforce, how do we best engage and help transition those those youth advocates to young professionals, right? So, and then eventually, we have that professionalized advocacy, that professionalized lived experience. And then eventually, supportive adults can really help support that work. But that's also, other people who are non-peers, non-lived experience, or not explicitly lived experience in organizations, funders, administrators, to really help support and understand what are the needs of this workforce and how can we best support that transition and that evolution of the workforce. So I'm going to pause here and just check in on the chat, because I saw a couple of questions, and I would invite, if y'all want to jump in and reflect on anything that you've heard so far. Does this resonate with what you're seeing out in the field? What else have you seen? So I saw this resources on systems, and then Angela shared what looks like a really cool resource for preparing organizational culture, recruiting and hiring, service delivery, supervision and retention. Yeah. Those were some of the solutions that we found as well that were necessary. So yeah, does anybody want to add or unmute and share their experience or reflection so far in setting the context? Oh, yeah.
Lacy,
Okay.
it's in Christina.
Yeah, Christina, jump in.
Thanks. Yeah. I just had a kind of question from towards the beginning of the presentation, when you were kind of, like you said, setting context as far as defining lived experience. I thought it was interesting that you talked about that kind of evolution from the adult peer movement into, and then youth starting to become more of a thing after that. And how it kind of came out of family support, because there seems to be kind of a division going on, or well, I don't know if it's going on or if it's been going on, but there's a little bit more literature these days I'm seeing about the separation between direct lived experience versus allyship and family experience. And not that one is more valuable than the other, but just recognizing that they are definitely different and carry different perspectives. And I was just curious if you had thoughts on that kind of separation between direct lived experience from one's own personal life versus being a family member of a person who has those experiences, and how that plays out in the workforce.
Yeah, it's a really good question. And I've certainly seen that happening both from an organizational standpoint, and then the movement and advocacy standpoint, and then in the job descriptions and, the national certifications that are out and all that stuff as well now. So, I mean, I would say it depends on what role you're expecting that lived experience to play in the function of the relationship, whether it's a direct service, peer support, or organizations, right? So I personally, if you're asking my opinion, I think there is value for each. It just depends on what it is that you're wanting to get, right? So I, as a person with direct lived experience, may be able to shed light and help like a family member who's dealing with it understand a little bit more, but that's not going to be the most effective for that family member, right? They might need more effective use from another family member who's helped support somebody through that process and been able to maintain their own well-being through that, right? So I think it's all very valid. And the thing that I think is really important is that we have the conversations about it and be able to understand what roles each plays and what's the purpose, but to not get into these comparative situations, right? Because it's just, this is my perspective, having been the executive director of a national nonprofit for youth advocacy across systems, but seeing how funding is set up and how it ends up creating this competitive environment, right? Across all of these people who have lived experience, who are trying to work together just to make, things better for people like them. And what happens is, like, you get into this competitive environment set up by funding structures. And then it's like, well, no, ours is more valid. Ours is more valid. And really, I think everybody's is valid, but it's just important to name what is the purpose and the function of it and which one is going to match best with the goals that we're trying to achieve. I don't know. Does that make sense? Yeah. See your thumbs up. Cool. Yeah. Thanks for the question, Christina. Anyone else want to jump in or add to that before I keep going? Okay. So I just wanted to be able to spend some time setting context before I jumped into the research for the capacity model. And so, we also looked at the needs, and particularly for young adults, they're still going through trying to figure themselves out. They're still in that identity phase of development. They're still figuring out how to meet their own basic needs in that transition phase. They're figuring out what they want to do with their career, which is normal and natural during that time. There's still, a lot of our young professional workforce are still undergoing brain development. Like, our prefrontal cortex still isn't developed until 26, 27, 28. And so that's still happening. And so we're expecting these young people to show up as full professionals with all of this, risk assessment and decision-making and rational thinking, but they literally don't have the brain power to do that yet. So they're still developing that, right? This workforce still has experienced really high ACEs scores and trauma that they may or may not have had a lot of effective treatment to heal yet. And so they're still bringing that to the work. Which is part of why we're hiring them, right? Part of what we're expecting in their professional skill set is that piece. And the high instance of re-traumatization with young people coming in to work with other people who are going through the same things, right? And this shows up to, with some of the rest of the lived experience workforce, some of this later stuff, but there is a unique lens through which we have to look at young adults, because all of this, the basic needs, the identity development, brain development, they're figuring out what solutions actually work for them in their mental health, like all that stuff they're still figuring out. Whereas if you look at more of the adult workforce, they may have figured some of this out. They may be past the brain development phase. They may, have identified what works for them in their recovery supports for mental health or, other lived experience issues. So there is a unique lens that we need to look at for young adults, which drives a unique support and skill set that supervisors and organizations have to know and understand to really be able to be inclusive of this workforce. And so then we're expecting people with all of these issues on the left, or these challenges on the left, to show up and be professionals, day one. So how do we really support and train and help supervisors and organizations from the outset understand what this really looks like? Like, we've got to be able to know that we're going to have to provide some personal and professional support. We've got to be able to teach, why is showing up on time, understanding, time and project management skill sets. Like, those aren't something that a lot of this workforce comes into in with. And so we've got to understand and remember that, like, we had to learn that at some point. We've got to be able to teach that to this group. And so, actively responding to triggering or activating situations at work, like, how do we navigate that? Like, adults, even social workers are still having a really hard time figuring out how to really effectively do that. And so, but yet organizations expect the lived experience workforce, or especially young experience workforce, to just automatically know how to do it and manage it and handle it, right? And so then, you kind of get into this where I think we get into this workman's comp kind of a situation, right? Because we're expecting you to use your mental health lived experience or your lived experience as a job and a professional skill set. And so when that gets damaged in the course of work, how are we making sure that we're providing reasonable accommodations and workforce support, in that situation? Because a lot of times what happens is the lived experience, like we'll get fired for the exact same reason we got hired, right? So how are we making sure that organizations are supported to do that? So really a lot of this capacity model work is building in what are the contexts and resources and supports, but really specific competencies, behaviors, skill sets that we need to make sure that everybody at all the different levels are equipped with to be supportive of this, depending on what the role and function is that we're expecting. So I'm going to skip through some of this. I think my PowerPoint is available, and this is a resource that's available online. We just published this 2021 in December. And so this was the ASPE project that did that review on all of the federal programs and how they're using lived experience. But some of the benefits that they found across programs and initiatives are able to better be more responsive to the people that they're serving, improve decision making. Agencies had increased awareness about what these issues really are, and improved prioritization, improvement in policies and procedures, right? Enhanced services. We all, I think, if we're involved in lived experience workforce at all, we know that like all of these are really great things, but there's a lot of benefits for individuals with lived experience, right? We get professional development, leadership opportunities, career development, increased self-sufficiency, agency, and empowerment were some of the outcomes that we saw from being involved in these kinds of roles, strengthen community connectedness. But one of the surprising things that actually they found out was benefits for staff, right? So we assumed, and part of what we researched is that the programs would do better, the outcomes would do better, they'd be more effective in services and policies. But what we found is that actually the staff who were non-lived experience, non-peer, working with the lived experience workforce, they actually really enhance their cultural linguistic awareness. They improve their professional skills and engagement and outreach, and they improve their awareness and knowledge. So they actually had a lot more feelings of connectedness and understanding and support for the work that they were doing and the people that they were working to serve who might be involved in systems. That happened as a byproduct of partnering with lived experience workforce. And so there was actually a lot of benefits specifically for the staff. I'm going to skip through these because I think we're all familiar with peer support. And we know we kind of sit in the middle here, right? So this like one directional, I'm giving you all of the answers, I'm the expert, I'm holding the space, and I'm helping you, versus this equal friendship on the other end, where it's this true reciprocal mutuality, and friendships or like self-help support groups are kind of like the 12-step community is maybe in that one, and we kind of sit in the middle, right, with this, and so there's more of a mutuality that happens, there's more of this level setting, but there is still a power difference, right, when we professionalize that lived experience work. And so really being aware of and understanding all of that and what that looks like in between these two ends of the continuum is really important when we think about what skill sets and competencies need to be in place. And so so this is where I'll jump into the research really. So what I was really excited about is taking these competency models. So I got certified in Korn Ferry and Developmental Dimensions International in their competency models around leadership. So there's been these leadership competency models across industry, right? In these big businesses, not really in our world, that have existed for decades. And the process through which they were using those was so inspiring, because you could sort through, like they had clear competencies, they had clear indicators of the competencies, the behaviors that were in line with it, the behaviors that what it looked like when it's overused or underused. And you could sort through and map out what were the primary, they have a whole competency library of like 140, competencies, but really people could sort through and do an expert sort and decide, which of these competencies are actually most important for this role and this function. And so through getting certified in that, it was just so awesome to see like, wow, this could really help our workforce, right? So be really specific about what are the roles and competencies, how do we teach those, what are the expectations of each job. Maybe a person who's running a program has different competency requirements than a person who's doing direct service or that's doing advocacy policy work, right? So there wasn't a model that currently existed for youth peer support. There was the national standards, and then the competencies for consumer peer support. There wasn't one for youth peer support. So this was kind of the first round of research that I did, is really identifying and adapting that adult peer model to the youth peer model. And so that's the first set of competencies that we really developed. And then moving beyond that into looking at the capacity model, right? So the Association for Talent Development, ATD, which is like the big talent development organization in the US, they moved from competencies to capacity. And so I'll talk a little bit about what does that mean and what's the difference. But really looking at how do we validate a competency library for this lived experience workforce, pulling from some of the HRD work, the human resource development and leadership work, things like program design, right? Like the ADDIE model, things like evaluation, understanding how to do evaluation and conduct that, things like organizational assessment and needs analysis, right? How do we, because I was doing all of those things as a lived experience consultant, but I didn't know what they were called. I didn't know there was a name for it. I didn't know there was a whole practice around it, right? And so really being able to name and be specific about what are these competencies that we're learning as a lived experience workforce, and what do we need to really solidify so that people can learn it and we can be more efficient and effective as a workforce overall. I hope that made sense. So when I'm not going to spend as much on the research design, but essentially we did a multi-phase exploratory sequential mixed methods design. And so we really did, the first phase was the qualitative Delphi kind of model with the focus groups and the subject matter expert panels. And then I'm still working through developing additional areas for other roles and functions. But and so then the overall design is to continue doing and validating the competencies that we need for each one of the types of functions and roles that lived experience workforce does. So you can see the kind of overarching phases that I'm doing and we've gone through for each one of those phases. And so for the first set of competencies, we did young people or young professionals who were over the age of 18 to adapt this process and the mental health standards to, or the mental health competencies to youth peer support competencies. And so we ended up with, 13 practice areas and I think 56 competencies that we developed with behavior anchor rating scales, bars. So we know exactly like what are the behaviors that we expect to see for each one of these competencies. And what does it look like when it's not developed yet, like the underused portion. And so through this process, we really were able to develop, you can kind of see an example here, right? So ethics and guidelines, right? That's practice area 1. And so the competency is ethics and guidelines, uphold ethics and guidelines for youth peer support practice. What it looks like when you've got it, what it looks like when you're not quite there yet, and what it looks like when you're overusing it. And so this model, this kind of the spirit of this model follows the leadership development, those big, huge organizations that are all around the world. And so we just kind of took the same process and reapplied it to this lived experience practice area. So we ended up with, let me get to the results and show you what we ended up with there. And then I'll come back and talk about the process a little bit more. So you can see the competencies that we developed, right? So we ended up with 6 themes. These are the themes here. So professional foundation. So that includes like ethics and basic youth peer support understanding, engagement with youth. So that was more, that can be engagement. This is with direct service, but that could be engagement with peers or with clients or whatever language you choose to use. Supporting youth outcomes. So this is, so there was one, the engagement was really more relationship focused, and how do you build rapport and build that connection and understand young people. And then the supporting youth outcomes is more around the goal setting and access to resources and that kind of stuff. And then crisis management, how do we really understand and support young people in crisis? Suicidal ideation and intervention is in this. What happens when there's major breakdowns or like their housing disrupts or, things like that. So how do we prepare the workforce to be able to have skill sets around managing that? Professional collaboration and development. So this goes to some of the organizational work, right? How do we as a lived experience workforce engage and collaborate with non-peers, with other agency heads, with our coworkers or colleagues that we have to work with, like clinicians, or if we're doing advocacy work and working with governments or funding agencies, right? So what are the skill sets that we as a lived experience workforce need to be able to collaborate in a positive way? And then leadership and advocacy. So there's specific leadership competencies that we need, like conflict management, like communication, like setting a vision, right? And supporting people to align with that vision. And then advocacy specifically is understanding when to use my lived experience to advocate for the workforce, right? For the lived experience workforce. How do I show up and represent this whole workforce overall? When does it not make sense? How much do I, when is big A, little a, when do I need to use that voice? And so ultimately for this competency library, for the more direct service peer support roles, we ended up with 56 competencies across 13 practice areas. And so I can show that but this is the 13 practice areas here. So cultural humility and responsiveness was a huge one that the subject matter panel experts really honed in on. Engages youth and young adults, individualized support, knowing how to share and when to share lived experience, how much, how little to share, supports goal setting, recovery and wellness skills. How do I know how to reach out to resources and services and supports? How do I find appropriate services and supports in the community? How do I develop those relationships with providers so that I know, when I need to refer or when I need some help to get young people or my people access? And then we talked a little bit about the rest of these, like collaboration and teamwork, understanding teams, how teams develop, how to manage a team, right? That's all from leadership work and team dynamics work in human resource development literature. Promotes personal growth and development. And then we talked about the last two a little bit. So this was the first competency library that we really went through and refined and developed. And you can see here the product as a result of that were these sort cards. So you can see the front here and the back here. So there's a few examples that I've gotten here, but I'll show the boundaries and consent, for example, was one of the, so you'll see the competency here is boundaries and consent, understanding, how do I apply that? You can see on the right, on the side here, the theme that's under is engaging with youth. The practice area is engaging youth in collaborative and caring relationships. And then what does it look like when you've got it? So you establish meetings frequently based on best practices and youth and young adults preference, ensure that youth has consent and wants peer support, right? Are they being assigned to this? How do I engage that and meet them where they are and where their motivation is? Goes over boundaries and the dynamic of their working relationship. So being very clear and how do you have that conversation around what boundaries are, what they're not, right, in that practice. And then you can see on the back side of the card what it looks like when it's overused. So we may be super inflexible, have really hard boundaries. We're not adapting to, what young people needs. And then what it looks like underdeveloped is that not yet. So we use more youth-friendly language to talk about what these areas are. But, we may be overly flexible and not teaching how to, hold commitments or how to, for young people to set their own boundaries, might be available 24/7, right? And which is not helpful for the workforce or for the people that we're serving. Not engaging, the youth peer support might engage in social activities that are inappropriate or cross ethical boundaries, right? So we've had examples of like peer supports taking young people out to the club as a social activity, right? And so like being really clear about what that means that it's not developed quite yet. So you can see these sort cards. And so each one of the 56 competencies has a sort card like this. And so you can sort through and use this in, which ones are the most important. You can do an important sort for the job role and function. Which ones of these are the most important, and you can sort out like the top 10 to 12, so that it's really clear on the job description. What are the competencies required for this role? Or you can sort it as like a self-reflective activity. Like, here's the ones that I feel like I do really well on. Here's the ones that I feel like I'm medium on. Here's the ones that I feel like I really need to develop. And then you take those and you can do professional development and learning around the ones that are not developed yet. You can also use this. These are not recommended to be performance reviews, but you can do these in like annual assessments or performance management assessments to see like, where am I doing really well? Where do I need to improve? And then really do your professional development plan based on those. And you can compare too, like if a supervisor does an assessment with these on how well they think that their direct report is doing, and then the lived experience worker also does the sort, then you can compare and see where they aligned on that and where are the discrepancies, so that you can really support and coach through developing those additional competencies. Okay, so I am, and then, these are just another example of one of the cards, shares lived experience, what it looks like when it's done well, when it's too much, when it's not enough. So I'll just leave this up for a second. I'm going to check in on the chat again. So let's see, similar when institutions, okay, talking about the transitioning out. Yeah, that's challenging. But like, again, if we equip our workforce to be more supported and be more clear in what they're doing, I think we do see better outcomes. Are the outcomes for staff working with peers specific to the youth peer workforce or the peer workforce overall? When you're talking about outcomes, which, can you just say more about that, Jason, if you want to unmute or
Sure.
Shannon? Yeah.
Hi, thank you. This is great. So you shared research that staff that worked with peers had better, I think it was cultural and linguistic sensitivity or competency. So is that specific to staff working with the youth peer workforce or peer workforce in general?
That was peer workforce in general. Yeah, that research was done across all agencies, all federal agencies, just to see where they used lived experience in their agency where they partnered with it. So that was not specific to youth, but it did help with youth culture as well. Yeah. Yes, great question. Yeah, so I'll pause here. Anybody have any thoughts, reflections? Do you see where this might be helpful? Have you seen any models like this that you've utilized? I'd love to get some feedback from the group on just on the competencies or, what practices you've seen that have been really helpful in this. Yeah, Todd, go for it.
Yeah, so I'm from Iowa. Go Hawkeyes. California's great too. I bet you're enjoying the weather instead of what Iowa's doing. But I think this has all been great. One of the things my organization is a subcontract to the actual Iowa workforce contract to train people, but also the ethics are important. But our profession, and that's the thing I think sometimes in this workforce, that some leadership and some partners don't see us as that professional. So I encourage, when I do the ethics training or the supervision training to supervisors, on asking if either party has shared the scope of practice and the ethics with each other, because we send people to be trained. However, we don't know if that supervisor even knows what they've been trained or what their actual role is to stay inside their lane, their boundaries, their ethics. And I think that is a good piece in what you're talking about. I was thinking about that when Jason asked that question, because to me, it's an overarching all, right? I mean, we do have different job descriptions, but I think for the most part, the ethics, the scope of work is that in itself, because, even a therapist going to school with their education, their lived experience of education, can sometimes maybe do something outside their scope. So keeping that in the workforce, I don't know that that's a question. Just wanted to make that statement.
Yeah, no, that's a great point. Being really clear on what the roles are, what the roles are not, and how they're supposed to work together, I think is one of the biggest pieces that at least was missing in implementing a youth and young adult workforce across the way. But I've heard also that has been a challenge for the peer workforce. And some places have really figured it out and learned how to collaborate and understand how they work together. Some places haven't quite gotten there yet. So really some of this is around like, how do we sort of solidify this for the whole lived experience workforce and be more clear about what are the roles, what are the roles not, how are they supposed to collaborate and work together effectively. And I think there's some places who've done a really great job figuring that out, but I don't think that we've gotten it disseminated out to all of the lived experience workforce or to all of the organizations that work with and partner with lived experience workforce either. So it's a great point. Yeah. Jason, jump in.
I appreciate the question, and I'm excited about this. So thank you for presenting. My next question is one of the things that we struggle with in California, where we've just passed a statewide bill that creates certification for peer specialists and all of that. And as that happens, the state is using SAMHSA's core competencies. And the issue is that those core competencies are not unique to peer services. So linkages to resources, all professions in the supportive system do linkages to resources. So are there distinctions, or have you discovered distinctions and built those into these cards that, what's specific in the peer practice in the boundary, right? Because a boundary for a peer is much different than a boundary for a nurse or a case manager. And how do peer support specialists stay within the peer boundary rather than somebody else's boundary?
Yeah, that's a really fantastic question and reflection. So I think the competencies kind of get to, what, right? The what is the boundary? What do we need to make sure that we understand as a workforce, particularly with this role, right? And so you remember that continuum where the peer workforce is in the middle. I think the how we teach it really shows up in some of that learning transfer, right? So in the trainings, that's where we can get into really specifics on the how. What does that look like in how we do it? And then with the on-the-job training and support, right? So when you think about the 70-20-10 model, so 70% of what we learn comes from on the job, 20% comes from coaching, and that can happen through the supervision coaching model, and then only 10% comes from that training. So I think we get to anchor the what in the competencies, and be specific. I hear you that the peer support competencies are not specific enough, maybe, or like in the context of what we're doing. So I think there is room to be a little bit more specific there, but it still talks about the what, linking to community resources, right? But then the how we do that is that 20% coaching and that on-the-job training. So a lot of it does go back to training the organization and the supervisors on what is the difference, what is the context specific for this peer workforce, and how is it different than what you're doing, right? So making sure that they understand that and how it supplements and works together. And so some of that I think comes a lot from the training. I don't know, I'm sure like there are documents or like other people on the call might have other more specific ways that you've really just made that distinguish like between the clinical and the other types of workforce. But I'm thinking of there's a really good guide that is referenced here at the bottom of this slide that John Delman with UMass at the Research and Training Center developed a whole guide on specific the youth peer workforce in mental health. And so that gives a little bit more specific context. But yeah, does that answer your question, or do you want to add anything?
It answers my question as much as can be. So thank you. And I mean, I'm hoping that as a professional practice, we develop some consistencies as things move forward. And I'm particularly interested in when you look at the using the framework for leadership development, you know, what skills emerge that are linked to specific peer competencies. I think that's going to be really interesting. That's going to help people in hiring. That's going to help with retention and also in training and job satisfaction for peers. If we're getting the right peers with the right set of skills for a particular competency, that makes a lot of sense.
Yeah. Yeah, totally. And increase that organizational commitment and that sense of support as well that we know helps with retention and feelings of, you know, efficacy in the job, right? So when we can be more specific and provide that professional support and people feel supported from the organization, then we see higher retention across the board. So yeah, that's awesome. I would say too that, you know, tying back to both of y'all's comments, the really, I think a huge piece that's missing is that supervision, right? Because and clarifying what the competencies need to be for supervision and being really explicit that it needs to support the, you know, personal and professional development. It needs to be specific to supporting the lived experience application in the work. And it needs to be more of a developmental approach to supervision and not simply, are you checking off your paperwork correctly? And that technical side, it really needs to be a developmental and transformational approach to supervision. And so there is a framework that exists in counseling supervision. And so that's one of the things that I haven't fully gotten there yet, but is in the future considerations is how can we really develop that, the competencies for supervisors around lived experience so that it is very specific to that developmental approach, that coaching approach, and how do you making sure that supervisors understand that application of lived expertise and really how to support that, whether it's direct service or program delivery or, you know, policy review or whatever, because those are all different skill sets that are necessary that all, you know, come from that lived experience application. Yeah, that's so great. And so I think I'm gonna, unless I don't see anybody else's hands up, I want to touch really quickly on the functions and roles, because this is sort of the practice that Developmental Dimensions International has. Rather than jumping straight to competencies, they look at what is the function of the job first, and then the competencies come from that function. And so what was found in the federal research project was these 5 kinds of functions that the lived experience workforce can take on. So there's the storyteller, right, where I'm educating or inspiring or, you know, motivating people through shared stories. I'm creating awareness, you know, through storytelling of lived experiences. And then you have advisors. This might be on, you know, an advisory board. It might be a board of governors. It might be, you know, some kind of committee at a state level or governance level, but really advising, like using that application of lived experience on how do we advise this program or these rollouts or, you know, whatever, which is a different skill set than storytelling, right? So that you might use some of the same skills, but you have to have an understanding and context of of governance, of policy development, of, things that happen. And so really equipping people for that role. A grantee. So these are people who receive funding to deliver services in communities. A lot of either community mental health will receive these kinds of funds and then they're required to partner with lived experience organizations, or there might be statewide grantees that receive that money directly to implement whatever the initiative is. And so that's a whole different set of skill set, right? Budgeting, reporting, right? So those are skills that are different that are required for that role. Partners. So that might be just organizations that partner to co-create initiatives or design, for example, a national evaluation that is more friendly to lived experience and engaging that and doesn't re-traumatize, right, than what would have been created without that partnering with lived experience. And then staff. This is the staff role is people who are hired either explicitly for their lived experience and to use that lived expertise as a skill set, or staff who just implicitly have lived experience and they're a part of the team. And so what do those roles? So the roles or the functions of the job actually would drive the competencies that are required for each one of those, if that makes sense. And so you can see here some of the types of functions that people had. Were like policy and program, peer operated services, research and program evaluation, communications, right? We know that if you don't communicate effectively in the ways and the mechanisms in which, for example, young people receive information, you're not going to have the engagement that you are looking for, and your outcomes are not going to be the same. So just really, and each one of these types of functions has different skill sets that go with it. So how do we really name and develop those in a way that's structured and intentional, rather than trying to figure it out over decades, of figuring out what works and what doesn't work. And then moving from competencies to capacity, right? So that's something that is a theme that is emerging in human resource development literature. Also ATD, just I think in the last couple of years moved toward that, the talent development organization. So, competencies have been around for a long time, but competencies are really like, what do you already know? Like, what can you do? And what's your current state of knowledge, and what are the current skills necessary to perform the job? Whereas a capacity model or capability model is integrating knowledge for an ideal or a future state, right? So being able to adapt and flex to meet future needs. And so that is really what I've now moving towards. So the competencies are a really good start, but really looking at what is that capacity model so that we can know exactly what are the skills that we need to achieve each one of these functions or roles, and how do we help the lived experience workforce move toward that, right? So rather than just learning enough to do this job right now, what does the whole workforce look like? What are the different functions that we serve as a lived experience workforce across systems? And then what are the capacities and skills needed for each one of those roles and functions so that we can move toward a fully integrated and developed workforce model, so that we can flex and adapt and really be more, really move into that lived experience leadership space. So I think that's most of what I wanted to talk about as far as where the research is, what we're working on. And again, like the application of this workforce model. So if you're interested, I would love to continue to connect and reach out as we're, working on developing these. Like I said, the competency model for the direct service, the youth peer support work, has been really highly developed and validated, and starting to be utilized in places. But we are still working through what are the specific competencies for some of these other roles and functions that we talked about. So, these can be used, like I said, in trainings, competency-based trainings. I know there's some certification programs happening, which is there's a lot of challenges to some of those, right? With like reading levels and access issues and non-youth friendly for the youth peer workforce. But I think this model could help with some of those things, using for assessments like we talked about, coaching, right? So that was one of the big findings that we had in the original research and the qualitative research, is that the lived experience workforce felt like they needed a neutral outside party to be able to talk to and to be coached through issues that their supervisor, they might not be able to talk to their supervisor about, because even if the supervisor is incredible, gets lived experience, are totally able to help support and develop that, they still have a power over. They still have the capability to write up, to fire, right? And so there is a limited ability to share as much as what a lived experience workforce would need to share. So maybe they relapsed, or maybe they had, some return to a negative behavior that they know isn't exactly helpful. And they may not want to share that with a supervisor, even a supportive supervisor. So making sure that there is a neutral party that understands how to navigate relationship with supervisors, that understands the workforce, the lived experience, unique needs. And so making sure that they have that. So there's a whole different, world out there, and capacity structure and model for coaching for the lived experience workforce as well. And then having developmental supervisory trainings, right? And having those work groups and those communities, and making sure that we're training supervisors on all of the unique needs of the lived experience workforce as well. So, we see the anticipated outcomes that were also mentioned earlier. I think Jason mentioned a lot of those: turnover, retention, trauma stewardship. So actually increasing our ability to manage and heal trauma through doing this work, right? If we develop the capacity model in a way that really supports that healing centered engagement, we can actually see higher positive outcomes with the workforce as well as the people that we're working with. And then actually increasing organizational efficiency. We talk about that in positive youth development work, but like when we truly engage with the lived experience workforce, not to make the organization better, but to partner to have better outcomes for the people that we're serving, the byproduct of that, when we do it well, is that the organization becomes more efficient. Right. So that's something that we've seen happen when it's done really well. And so how do we make that intentional and create that capacity for the lived experience workforce and organizations to come together and do? So, I want to leave some space for questions, thoughts, reflections. My email is here if you want to reach out. And I so appreciate the conversation. Yeah, Jason, I've got your email here too. But yeah, I want to open it up to any questions, thoughts, comments anybody has about the state, the work, the future work, or anything that you're doing that you want to add to the conversation that you think is helpful. Yeah, Betty.
Communication skills are something that is often thought as innate because people can talk. Well, it's not true. Communication skills really need to be taught. Yeah. And I think it would be helpful for peers to have some communication skills.
Yeah.
Part of the program.
For sure. Yeah. And that shows up in the leadership skill set too. So that's a top leadership skill that all leaders need. And so how do we make sure to teach that as a skill set in the lived experience workforce is a great point.
Yeah, I rescue horses, and that's one of the things that I use them for, is teaching communication skills. It's awesome.
Yeah, that's great. Thank you. Yeah, Todd.
I'd just like to say thank you for the presentation. I think it was wonderful. And I would, even being here in Iowa, I'd love if you would be able to share your PowerPoint with me, and I can have a conversation with my contractor for the Peer Workforce Collaborative.
Yeah, that'd be great. I would love that.
Great. I shared my email in the chat with you too.
Perfect. Yeah, thank you. Yeah, anyone else? Any my OD gurus in here or my IO site gurus, any reflections, comments, or anything that you would add? Okay. All right, cool. Well, I appreciate y'all jumping in and joining and the conversation. I love getting to learn from each other and when we can all work together towards a much bigger goal. And so I think unless we have anyone else that wants to jump in, we might end just a couple minutes early. I don't know if we have any messages from the moderators. Okay, I don't think so. All right, well, thank y'all. Please feel free to reach out. I screenshotted your emails to send you a copy of the presentation and hopefully hear from you and cross paths again soon.